Hi, this is Nina talking about the differences of working in rural healthcare versus inner city healthcare. I currently work in an assignment that is extremely rural. It's actually a critical access hospital. What does that mean? It means it's governmentally funded. It is a way for extremely isolated areas in the world to obtain health care in ways that may be different than the mainland. Speaking specifically of a rural island in Hawaii, you and I may on the mainland go into a level 1 trauma center or level 2 to receive health care, or if it's a weekend you might pop into an urgent care and or get a quick appointment at your usual doctor's office. Well, here there's only one out of two options to receive health care in the first place in a hospital setting, and it's not anywhere near the level of trauma that we have available to us in the mainland. So instead of going into the clinic or an urgent care, they may have to just come into the emergency room, which is only five beds available, 2 trauma bays. If patients are often very critically ill, it is in a way the critical access works is we work on transferring them to a larger facility, most likely in Oahu. Otherwise, we have a 4-bed intensive care unit here, which is very interesting because of the government funding only gives you so much. There's different things that aren't available here, such as there's no lab on site or x-ray 24 hours a day. If you need something on the night shift, you have to call someone in. This usually happens quite efficiently, but it's a little difference in care. I myself work in the one nurse working in a night shift, a 12-hour night shift by myself in the intensive care unit. So if something goes wrong, you really have to be comfortable with your skill level, be able to work under pressure, know where your resources are and how you can find them in a short amount of time as a traveler, things like that. I also feel like going through this opportunity has taught me a great deal about myself, that even when you sometimes might doubt your own abilities, having good experiences like this will prove to yourself that you are able to execute when needed. But that also comes with the fact that I've also worked in multiple level 1 trauma centers and gotten a lot of base that way in nursing, so that when I come to the small place it is more comfortable. Inner city healthcare is its own little thing. Level 1 trauma is just a whirlwind of activity. It really teaches you to be strong on your skills, really understand what is hemodynamically stable, what is the pathophysiology that's occurring in a trauma versus a heart attack versus a transplant. Learning the various medications that are available. Working in a teaching facility is also another interesting spectrum, as you may be working with residents that are also learning, so you kind of have to bounce ideas off of each other, and maybe you're not going to get the right answer immediately, but if you work together you will get there. It also teaches you good ways to use interdisciplinary skills and communication, that it's okay to bounce things off of someone else and maybe you'll learn something. There's often inner city hospitals have a great deal of resources available at all times, like respiratory therapy, pharmacy, all that kind of stuff, that you really have to work together with your ancillary staff and make it whatever possible for the patient can happen quickly. Yeah, that's enough.